You've lost one tooth, and your dentist has mentioned an implant. Here's what that actually involves. An implant replaces one whole tooth, the visible crown on top, and the hidden root inside the jawbone. It has three parts: a titanium post acting as the root, an abutment connector, and a custom porcelain crown. Teeth are usually lost to decay, injury, gum disease, a failed root canal, or being congenitally missing. Dentists check for healthy gums, enough jawbone, and good general health. A 3D scan guides the plan. First, the damaged tooth is removed if needed. Sometimes a small bone graft is added to preserve the socket. Under local anesthesia, the dentist places the titanium post into the jawbone. This usually takes 30 to 60 minutes. Over 3 to 6 months, bone cells grow onto the post and lock it in place. This is called osseointegration. Once integrated, the abutment is attached and a custom crown is fitted, matched to the shape and color of your teeth. Recovery is usually gentler than expected. Mild swelling lasts a few days, and most people return to work quickly. Alternatives include a dental bridge or a removable partial denture. Each has different trade-offs in time and tooth preservation. Risks include infection, delayed healing, or rarely, nerve irritation. Smoking and uncontrolled diabetes raise complication rates. With daily brushing, flossing, and regular dental visits, a well-placed implant can last many years, often decades. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.